And now really is the moment to start the conference with the first plenary talk. And also it's my pleasure to give the floor to our keynote speaker, has been introduced now, Dr. Maria Neira. When you want. Thank you.
Thank you. Thank you. Good morning, everyone. And hello to the good friends that I think I have in this group. Tony, a pleasure to see you and many others. Has been a long time, but we always keep in contact through the work that we are doing with This is Global and others. A pleasure to be with you this morning, and particularly a pleasure because it's a critical moment. So having this space for dialogue and maybe getting the global health community a little bit aligned, mobilized, and making sure that we are all moving into the same direction is a very good opportunity. I'm just back from Glasgow. I'm sure that you have all been following the discussions there and how critical the importance of the Glasgow Climate Pact will be for public health. But you, Tony, you were mentioning the importance of global health and keeping that old mantra that health is not just the absence of disease. I think more than ever, this is extremely relevant. And this is where all health professionals dedicated to health, we need to make sure that our work is not just at the hospitals, which is an extremely relevant role. And of course, we need to be the best in terms of providing the most advanced treatments and care for our patients and rehabilitation. But we need as well to go and take the space on the promotion and prevention and creating the healthier environments that we need as well to protect our health. And this is where maybe that space has been a little bit empty, and now we need to go back there. The reason I'm mentioning Glasgow is because I think what we have presented there as the global, the World Health Organization and the global health community, because we presented the health argument for more climate action, and with 10 recommendations. And we presented that backed by the signature of more than 46 million health professionals around the world, of course, represented by more than 600 institutions and networks around the world. And I think this is extremely important. It proves that, again, the health professionals are now very much convinced of where are the bases for our health and what are we doing wrong? What are the structural failures that we need to repair? And if we do not repair that, we will not have we will not reduce our vulnerability vis-a-vis any other potential or possible outbreak, pandemic, or infectious diseases threat, or any other threat for our health that might come from different areas. So because I have 10 minutes, I would like to share with you the 10 recommendations that we presented at COP, thinking that those are so common sense, basic ones, and the ones that will help us to address many different health outcomes, from reducing vulnerability to infectious agents, to promoting better use of our antibiotics and therefore reducing this antimicrobial resistant pandemic that we are facing as well, or looking at issues like air pollution that are representing one of the major public health issues we are confronting now. And so the 10 recommendations are very simple. The first one is now that we are in the recovery phase, we need to commit to a healthy, green, and just recovery from COVID-19. There will be injection of critical amount of financial support coming from different sources that the different governments will be now injecting into the economy. We need to make sure that those investments are going into the right direction, protecting our health, and we can discuss a lot about that, but we have proposed several ideas where those funds need to be invested, not only to protect our health, but to protect our economy and our sustainable development, and of course, a fair transition as well. The second recommendation is, again, very basic and obvious, but it's good to say it, is the fact that our health is non-negotiable, not negotiable. So we can go to the COP, we can go to other conventions and where people negotiate, that they negotiate the reduction of emissions because they are looking at economic values and environmental values. For us, the reduction of emission is not negotiable because it's about how this is affecting our health. So we need to make sure that public health is really at the heart of all of those climate negotiations and other environmental conventions negotiations, but not to negotiate for our health, but to say how many lives you are putting at risk or saving, depending on the decisions that you are taking. The third recommendation, and this one probably the health community is not enough aware of, is promote healthy climate commitments. The health community might not know that there is something called national determined contribution, which are the commitments that each country is making at national level to say, okay, this is how I will be reducing my emissions and going to implement the Paris Treaty. Have a look at your national determined contribution, the one of your country, and look at whether health has been prioritized over other interventions, or whether those interventions that have been prioritized, they are the ones that will represent the biggest possible health outcome. I think familiarize our health community with the NDCs, not NCDs, the non-communicable diseases. This is NDCs. I think it will be extremely important because there will be a lot of important decisions around that, and we need to be part of this discussion and making sure that the health sector is properly represented. The recommendation number 4 will be, we need to build our own health systems more resilient to climate risks. As you know, at the moment we are talking, there are still many places around the world, many healthcare facilities in sub-Saharan Africa and other parts of the world, that they are not contributing at all to the carbon footprint because they don't even have access to electricity. So we need to make sure that at least that they can be adapted and they can be more climate resilient because they are already confronting diseases linked to the global warming, and they need to be better prepared. But at the same time, and this is very important and I need your help on it, in COP, under the presidency of the UK, we have presented an initiative by the health sector, which is called Decarbonizing the Health Systems. And we have already 52 countries committing to decarbonize their own health systems. Of course, we are talking about medium and high income countries. They want to reduce their own carbon footprint. If you put together the global emissions of the health systems globally, worldwide, it will represent a 5% of the carbon emissions. Can you imagine? So we need to lead by example and we need to reduce our own carbon footprint. There is a guidance on that. There are different initiatives, and WHO will put now a platform to help countries to do so. But this is very exciting, and if you can discuss with your own national health systems, because this can represent a very rewarding experience for the health professionals. We will reduce energy consumption, water efficiency, chemicals used at the health centers, at the healthcare facilities, the food, the waste produced, the transport. I mean, many things that, again, we will take a lot of time to discuss, but I think it will be very interesting for all of us to have the opportunity to discuss and to join that initiative. The recommendation number 5 will be the issue of the energy. We need to be part of this energy transition. We cannot, we need to guide the transition to clean, renewable sources of energy if we want to reduce the more than the 7 million premature deaths occurring annually at the moment because of air pollution. And as you know, when you live on a polluted environment, your lungs will be more vulnerable to any infectious respiratory agent that will be around. And of course, it was not special. It was clearly linked to the exposure to SARS-CoV-2. The recommendation number 6 is something that I think you are very familiar and very good at. Reimagine urban environments, transport and mobility, making sure that we have livable places more sustainable, healthy urban design, healthy urban planning, and having access to green spaces, priority for walking, cycling, and public transport. And you know, this is a big challenge for all of us at the moment, and we are not yet there. At the moment, the cities are constructed for our lovely cars and not for us. That has to change. Recommendation 7 will be, again, very obvious, very basic, but really the fundamental of our health. We need to restore nature as the foundation of our health. We need to stop this stupid battle that we have with ecosystems at the moment and recognize that all comes from nature. I mean, the food, our food systems, our livelihoods. I mean, we obtain water, food, air from our nature. How can we do in this destruction and treating it as if it was the waste bin or something like that? Almost there. Recommendation number 8 is about the way we produce our food. It's about promote healthy, sustainable and resilient food system. At the moment, as you know, we are wasting 1/3 of the food produced, which means that we even need to manage the waste. And if we were moving into a more healthy and sustainable and resilient food system, we could even save almost 5 million lives every year because of the promotion of healthier diets that we are missing at the moment. 9 is very critical. We need to stop subsidizing pollution. We need to stop giving money to what is killing us. And at the moment, we are still giving almost $6 trillion every year on subsidies to fossil fuels. And then the combustion of those fossil fuels are literally killing us. So as a public health community, I think we need to raise our voice and make sure that that money could be spent by our health system. There is no way to compete with that amount of money. Our health systems are paying the cost, I mean, the externalities of that combustion of the fossil fuels, those subsidies, by providing care to those chronic diseases caused by the exposure to air pollution. And that money, that cost, which is around 5 trillion as well, is not included on the economic discussions around subsidies for fossil fuels. So please, we need to use that money properly and stop using the taxpayers' money to kill ourselves. That is certainly not very intelligent as a society. And the last recommendation is mobilize the health community. There are a lot of movements now. As I say, the health professionals, 46 million, were signing that letter that we took to the president of the COP, making sure that doctors, nurses, I mean, the health professionals at large are fully involved and mobilized for urgent climate action, because this is not just a question of environmentalists, this is a question of health. I think if we move on those 10 recommendations, our global health will benefit enormously from cleaner air, from better, healthier diets, from better mobility, less sedentary lifestyle, and therefore all the non-communicable diseases attached. And of course, by restoring our relationship with nature and stop deforestation and trade and consumption of wildlife, animals, or intensive agriculture and use of the pesticides, we can as well reduce and protect better that barrier between the animal health and human health, and make sure that the concept of One Health is incorporated at once. I hope this covers a little bit and provides a basis for a dialogue and questions and debate. Thank you very much. I will stop here. Thanks.
Well, okay. Thank you very much, Maria Neira. We have not met personally. I'm Roger Perez. I'm a physician here in Badalona. I've had the chance to collaborate with some WHO groups, the WHO drug resistance group, and more recently the COVID-19 group. So I am really very much aware of the huge effort that you are all guys doing. Everybody wants to belong to the WHO. Everybody wants to collaborate with the WHO, but then all these issues are it's really hard not to agree with you with all these 10 points, for example, that have been that you have summarized. But then at the end, it's all about the details, and then the devil is in the details. How the implementation, how can we actually truly implement them? So I have a couple of questions, but I will leave. I'd like to ask the audience to submit questions, and I will give preference to the questions from the audience, and maybe I will ask you also a few questions from my own. So please, I would really urge the audience to send a lot of questions, because it's really a pleasure to have Maria with us. So the first question is, it's anonymous, so we don't know the name from who is asking, but the question is, could you comment on the link between climate action with emergence of infections with pandemic potential? I will take the liberty to modulate a little bit this question. Are we expecting more epidemics? How, when, and what should be preparing for?
Yeah, thank you. And nice to meet you, Roger. I know your name, and thanks for collaborating. And as you say, we are all WHO. After all, the beauty and the power of WHO is exactly that, to be able to convene the best experts around the world and calling you when we need different working groups. And I have to say that everybody responds positively and in a very constructive way. So thank you very much for that. Yes, we need a pandemic treaty. WHO has been promoting that idea. We need to, as you know, we have the international health regulations. I will invite people to have a look at that, because many of the things that we are trying to promote now are already included there. But probably we need to go a little bit beyond. The probability or of having other outbreaks, other epidemics, or other pandemics is of course there. It will depend very much on us. We cannot reduce the vulnerability to completely zero, because we interact, we have this permanent interaction between human health, animal health. But I think the third one to be incorporated, and is probably the one that we have been paying less attention, is the environmental health. So on this concept of the linkages between animal health and human health, the zoonotic diseases, I think, is more traditional or more on our comfort zone for the health professional, but the very explicit and intrinsic linkages between human health and the environmental health, I think it needs to be a little bit more explained. I was talking about the deforestation. For instance, of course, deforestation will put us at risk. Why? It changed completely the ecosystem, so you will have a different, completely change on the level of humidity, on the pattern of transmission of certain virus. We live with millions of viruses. Which one will survive? The big mistake will be to prepare a pandemic preparedness and response plan for the future exactly as a design responding to what's happened right now with the SARS-CoV-2. That's a mistake, because it's like in the airports when we have now the security measures, they ask you to take your belt, they ask you not to transport more than 100 milliliters of certain liquid, but you can have two recipients with 90 and 90. I mean, where is the logic behind all of this? And nobody is reviewing whether those measures are responding to the threat or not. So on pandemic preparedness and response, we need to be a little bit more intelligent and design something that will, as a final objective, reduce our vulnerability. Okay. So reduce our vulnerability means stopping this aggressive deforestation, means having a better connection and understanding of the human health and animal health, zoonotic diseases. What are we doing with the antibiotics in animal health is maybe for another discussion, but if you have involved on antimicrobial resistance, you know what I'm talking about. We need to look at what means the use of fertilizers, pesticides, how we are polluting our water with chemical products. All of that is putting us at risk. The contaminated air. I mean, look at what the epidemiology is telling us. Mm. It's telling us that those cities that were very polluted before the pandemic, where people has been exposed to high levels of air pollution, of course, their lungs were more vulnerable. And that people will develop the diseases that then will, the underlying diseases, and then will put you at more risk to develop severe forms of COVID-19. So all of this and understanding how much what is around me, my environment, put me at risk or protect me, I think is the critical different piece of interaction we need to change and policy that we need to do now.
Yeah, thank you very much. So, and then one specific question, is WHO working to define optimal and global surveillance systems for emerging and new pathogens?
If WHO is working to create one or a...
Yes, to define optimal and global surveillance systems.
Absolutely, and it has been created recently in Berlin, a hub on epidemiological surveillance and critical intelligence and all of that. So definitely this is a very critical piece of the puzzles as well. Yeah.
Okay. Perfect. Then I think you have answered these already. The question is, will climate change increase inequities, and in particular inequities in access to health? I think you've said yes. And
definitely yes. I mean, look at today, New Delhi is closed down. And it's not because of COVID, it's because simply they cannot breathe. I mean, the levels of pollution are such that you and you cannot see. You don't see 20 centimeters from you, you don't see. So they stop the functioning of the schools and all of that. And what I'm saying, Delhi, because the inequities on the pollution and are incredible. If you are poor, you cannot escape. I mean, if you live in New Delhi, if you are rich, you will breathe that air as well, but you can stay at home, you have other systems of ventilation and things like that. But this is definitely affecting more the poor people who have not any resilient capacity for adapting quickly and responding quickly to that.
Okay. So how do you see our vulnerability to emerging infections given the aging population and rise in prevalence of comorbidities and NCDs?
Well, I think that the question provides the answer already. I mean, yes, exactly. The fact that we have an aging population, the fact that we have an epidemic of non-communicable diseases, chronic diseases is putting us on a very vulnerable situation. And that's why our cities need to be cities where we can breathe and we can interact socially. And I'm thinking of mental health as well, which is another one. So the sooner we do this healthy urban transition, a healthy energy transition, and healthy food system transition, the better, and we will reduce non-communicable diseases, and somehow we will reduce our vulnerability. We will not reduce the aging. We want people to age, but we tend to age on a healthy way.
Perfect. Thank you very much. Then we usually see the WHO, or at least in the past, the WHO was a sort of a moral reference, and where the speeches made by the WHO were what would be right and nice and democratic and everything. But now, gradually, I don't know if you agree, we since a few years until now, in the recent years, we are asking the WHO to execute more things, to act, to change policies, but not only by the power of words, but also by doing a very specific things. And we've seen that in the recent epidemic. And we have major challenges. One absolutely major challenge is the vaccine inequity. Of course, with COVID-19, for example. And we can see how rich countries are already considering third dose or boosting dosing, whereas in, I would say, more than 85% of the world, there's not even access to a single shot of vaccines. In addition to the purely medical problems that these will imply, it also implies that the already existing gap before COVID-19 between rich and poor countries will become larger and larger and progressively larger, because we will have rich rich communities essentially protected or largely protected against severe disease, whereas poor countries will be really affected, and we might be seeing reductions in mortality. So and also at the same time, we are discarding vaccines shots here, because in Spain, in France, in the UK, now we have sort of vaccinated almost everyone who wanted to be vaccinated. So what can be done? How can we tell, for example, how can we tell the European Union to start sending or to start, buying or paying for vaccines to be delivered in poor countries? What what is being done?
I think you're touching many very important issues. One is the equity. The role of WHO is a moral voice. Or I remember when I was a child or a very young student at the medical school in Spain, when somebody was saying, according to WHO, and that was kind of the Pope has talked, to maintain that moral role, you have to be very credible. You need to be very rigorous. You need to have a very methodic assessment, and your recommendations needs to be really based on science, and we need to maintain that. But at the same time, it's true that now more and more people want WHO to be a kind of Médecins Sans Frontières type. I mean, being responding at the field level, having an army of doctors responding there as well. At the same time, we need to be very good with the media and communication. We need to communicate. We need to express very well. We need to be at the front of the political issues, telling the governments you are not doing well if you are vaccinating your people, but you are still keeping I think we are at 22% now on our global vaccination. And so it's a huge role, that is true. But it's the World Health Organization. So the mission is amazing, and we will have the WHO that we want to have. After all, there are 194 countries as members of WHO. So they will have the WHO that is needed, the one that we all wanted, and the one that responds to the needs of our citizens. So, and for me, the role has to be increasing. And yes, global is a very novel.
But how can the WHO influence, for example, very specifically the European Union, to make the choices? Because we will have all those vaccines will have to come from a taxpayer's money, so it will come a fraction of my money will have to be used for buying vaccines to poor countries. So, and of course, there's a market issue here. So how can you?
Well, I think you heard Tedros very often saying that this is totally immoral. We have obviously bilaterals with the president of the European Commission and the parliamentarians and ministers of health, ministers of finance, because these days of course, our interlocutor is there are ministers of health, our natural, I would say, partners. But these days we talk a lot with prime ministers, ministers of finance, ministers of energy, ministers of development. So it goes, our role has been going where the health can be influenced. And most of the time, the health can be influenced, particularly on the issue of the vaccines, by ministers of finance. So we are very often calling on the health and economic argument for giving vaccines. And the discussions with the European Commission are very on a daily basis. And in addition to that, the voice of WHO through our Director General on calling on this global solidarity and the lack of equity is used as much as we can. Yeah.
Okay, thank you. So this is a huge effort, and I really thank you for all that. So, in addition to the classical policy making or policy advising role of the WHO, we have seen also during the last pandemic that the WHO has been increasingly involved in the development of actually clinical trials, which is something that maybe I missed it, but that was not what I thought the WHO was doing in the past. So I have many questions, but I will have to simplify. So the first question is, why did you decide to get involved into clinical trials? Are you ready for development of, you mean in terms of the WHO, for the development of clinical trials, which are usually being done elsewhere? And then afterwards, I have a couple of very more specific questions on clinical trials.
Thank you, Roger. And I see that you are a clinician, so that's why you are very much interested on this issue of clinical trials. Yeah, WHO did in the past some clinical trials, but you're right, it was not one of our critical missions, because what we do is we collect the results of clinical trials and then we translate it into policy recommendations. But this case was absolutely, the urgency was such that somebody, because many things were happening in different hospitals in terms of clinical trials, but somehow the idea of creating a platform to bring everybody together and understanding what were the 3 priorities at that moment, the questions we needed to answer this as soon as possible. And I have to say that it was a very, very good experience. We call on different hospitals and we proposed the protocol. The response has been amazing by all the hospitals we have been contacting and others that voluntary approaches. And thanks to that, I think we could provide, not WHO, I mean, WHO was just creating the platform, the system, the method, and then collecting what the different experience we're doing. Obviously, the different hospitals will be communicating already among themselves, but that this platform has helped a lot to accelerate, to be more systematic and to avoid overlap and define the priorities and respond very quickly to several questions that I think were critical at that time. Whether we will be expanding now from that and then be on more, I think on critical issues, probably there will be a need for that. But in others, maybe we will leave the science to keep produce as it was in the past with all obviously the system and methodologies are approved by all of us. But in this case was absolutely critical, that role, and very rewarding. Honestly, big thanks to all the hospitals who have contributed on such a generous way, extremely generous, no egos, no visibility, honestly, very, very positive experience, and with very, very few exceptions, a very generous response by everyone.
Yeah, that's cool, because usually in the clinics we work with the concept of evidence-based medicine, but the problem with a pandemic like COVID is that there's no evidence. So,
exactly.
So you have to start treating patients with whatever you have in hand, and then you have to generate that evidence. We like to call it clinical trial-based medicine, which I think was a very good thing that the WHO did. I have a specific question from Narcisse Sauvi, which is sort of related. So he's asking whether WHO is driving studies to assess efficacy of COVID vaccination programs using heterologous vaccine vectors, for example, mRNA plus subunit vaccines as booster, or is this action only done by vaccine developers?
That's a very good question, and I don't want to go into details because I'm not a specialist on that, but I know that we have put together several working groups, and one of them is working on that, but I'm not a specialist on that, so I know the generalities, but I don't feel comfortable to answer that question to one specialist. But there is a working group specialized on that, so I can put you in contact with.
Thank you very much. Thank you very much. We cannot be experts on everything, and that's something that's also good. So also we are asked whether you could comment on COVAX and access to vaccines in low-income countries.
Well, sombras y luces, you know, light and shadow here. Of course, COVAX have gave us a lot of satisfactions as well, good responses. Thanks to that, we have been able to provide billions of vaccines now, but our idea was to reach by the end of this year 40% of the global population to be vaccinated, and we are not yet there. So a lot of effort still to be done, and calling on the solidarity of the countries is not a question of solidarity. I think it's a question of, again, be pragmatic. Even if you don't want to do it for solidarity reasons, do it for pragmatic reasons. You have an interest in having the population vaccinated. So we keep on thinking that 40% should be vaccinated at the end of this year, and we still miss, I think, 500 million. And for next year, we would like to reach the 70%. So a big effort to do. course, no waste of those vaccines that we have already. I have to say that globally, the planification on the use of the vaccine has been very smart and very cost effective, but of course we have little problems here and there, but calling again to everyone to be very smart on this one and understanding that we all need to be vaccinated.
And then let me ask you a little bit a controversial question, because this will make the debate even more interesting. It's all about patents, right? There has been, this is clearly controversial. Some people are claiming that we should just erase COVID-19 vaccine patents and not take it in, delete them and then work as if they were not there. Others say that patents are not the problem, it's more a problem of distribution. Then what's your personal opinion?
Yeah, I don't even think that is controversial. I think it's something that I am a little bit surprised that has generated such a reaction. So we are on the middle of one of the biggest public health threats and challenges and crisis, where even on the patent you have something that says if the crisis situation requires, you can remove the patent. But very surprisingly, we had a very conservative reaction by our society. Anyway, what WHO wants is to make sure that the vaccines will reach the people. So we need to remove several obstacles. It's true that it's not just the patents, it's true. But this is one of the things. I mean, we need to make sure that here the intellectual protection is, of course, a principle that we will protect. But there are certain pieces that can be, technology transfer. Then we need to look at what are the other barriers and remove it as much as possible, because we need to provide that vaccine. Is a global good at the moment, that vaccine. And in terms of the economic argument that has been used and saying, well, if we remove patents, then the pharmaceutical companies will never invest on developing drugs. Well, the recovery of the financial investment, I think, has been largely done. So that's not an issue. But again, it is true as well when they say that it's not just the question of removing the patents is difficult. But if we don't start, all of those obstacles will not be addressed. If you say that it's a very difficult technology transfer, sure, not all the laboratories around the world will be able to do it, but there are certain things and certain places and certain facilities where if we start now, the transfer of technology, they could develop. If not, they will never develop, that for sure.
Good, thank you very much. It's an honor. I thought we would have problems with having questions, and actually the problems we have more questions than those that we can answer. Then following on patents and vaccines, also now we have these new antivirals, for example, the oral antivirals, molnupiravir, right? So that actually could decrease the molnupiravir, the Pfizer antiviral, different antivirals that could oral antivirals that could potentially reduce, they seem to reduce at least between 50 and 85% the risk of complications in high-risk patients. Of course, it doesn't make a lot of sense to promote that in an environment where there are no vaccines. But nevertheless, at least we've heard news from molnupiravir that Merck has reached an agreement with the Medicines Patents Pool, and this is a drug that will become available in low-income countries at a relatively low cost. We'll have to see, but maybe it's around $4, something like this. How do you see this issue? Do you see a niche for these drugs, or do you think it doesn't make sense? Or
listen, when you are fighting, it's clear that more tools you have, the better. So having new drugs, antiviral drugs that prove to be effective, even if it's just to reduce the clinical, which is already something very important. So WHO is looking at all of those two drugs that the Merck and Pfizer, the antivirals that they are presenting, and it could be an important addition to the arsenal that we have already. But this takes me again to the issue of the patents. You don't need to remove the patents. What you can do, one of the other possibilities, is to have a differentiated price. So We did it with the antiretrovirals for HIV/AIDS, and it can be done as well for this type of drugs if they reach and they go to the market. There can be a differentiated price for different countries or different economies, and then all benefiting from that. But we are at the phase of still assessing the two antivirals at the moment.
Thank you very much. Thank you very much. And then we have a couple of questions going back to environment, pollution, and what we were discussing at the early. So the first question is by Jose Antonio Rodriguez. He says, during the history of humanity, there have been pandemics, although we have never polluted like now. How to understand then that we have to pollute less if there have always been pandemics despite not polluting?
Well, we were polluting less, that's for sure. We were less as well, less population, and we were not as concentrated on our own cities as we are now. One of the problems, and this is basic epidemiology, is that now our cities, you have a huge concentration of population. Think that we have cities with more than 15 million people living there. So this is a perfect environment where things can be, any infectious agent can spread. In the past pandemics, in the previous centuries, the population was more spread, and they were very much related to pollution as well, because infectious agents like cholera, for instance, were related to the pollution of water or the pollution of food. So in fact, pollution was already present, or lack of hygiene, or very basic issues that we today, in principle, we control. But with the massive pollution we are having now of the air we breathe, which is, obviously our health depends so much on the quality of the air we breathe. If you talk about infectious, respiratory infectious, having your lungs exposed for a long time to pollution will create important risk factor. Us being a smoker will represent as well a big risk factor. And we have another type of pollution today, which are the non-communicable diseases. Somehow this is our big risk factor as well, that is accelerating or creating more severity for all of those pandemics. So it's not just the pollution will increase pandemics and non-pollution will reduce it. I think it's much more complicated than that. But today we have the risk factors which are in many fronts. I mean, cities that are very much densely populated. We have poverty around many of those urban spaces. We have huge pollution, chemical and toxic in the air. And we have a system of producing our food, which is increasing our sedentary lifestyle. So if you put all of those risk factors together and the way we destroy the nature, I think we are creating a very dangerous situation. So if we are smart as a society, we can change that.
Okay, then two difficult questions. One is, how can we reconcile the need to confront climate change and the need for development in low-income countries?
Okay, this is a non-issue. I mean, no. I'm from the north of Spain. I'm from Asturias, and I grew up with this idea that, okay, it's all polluted. It was black carbon everywhere. At 5 o'clock, we have this horrible chimney throwing away tons of black carbon, and everything was black, and everybody was asthmatic, but who cares? I mean, we were developing economically. No, sorry. Today, that area in Spain where I grew up is richer than before, and we don't have such an asthmatic population. And our Rio Nalón, the river Nalón, is not anymore solid and black as it was. And the mining people who were suffering very much, of course, you can always say, okay, the moment we stop the coal production in Asturias, the economy went down. You know, you have to be ready for the transition, it's clear, but the transition needs to occur. We cannot keep saying that if we don't produce coal or we don't use petrol, our economies will be poor. Look at the Norwegians, look at the Scandinavian. They are rich and they are the most environmentally protected people. So that is not correct. Look at India now, with all of these levels of pollution, the economy is going down.
Mm-hmm.
So, thinking that the only way to develop the intelligent societies are those who will invest very quickly on a transition to the clean sources of energy, renewable sources of energy. Your economy will go like this, and at the same time, you will protect your health. So it's a question of transition. We need some time, but it's definitely not in opposition to an economic development at all.
Thank you very much. I think this is a very important statement. 1 minute left. I'm sorry because I'm leaving a couple of questions out, but I want to make a last question. It's like the WHO needs money. How can we give money to the WHO? What's being done? Otherwise, without money, it is very difficult to implement all the things you wanted.
Yeah, just because we have very little time, I will tell you that our budget is the equivalent of the Hôpital Cantonal, which is a little hospital in Geneva. Not in, I mean, so that gives you an idea. But sometimes with little money, you can do miracles if you use your influence, your institutional capacity, and you call on the best experts around the world. So we need to reinforce our role and mandate, and then the money, if it comes, that will be great, of course. But if not, we will keep influencing and using all our capacity.
Okay. So, well, thank you, Maria. It was an honor for me to be able to talk to you and discuss with you. I hope that the audience, I think that we could have continued for many more minutes. So thank you very much for participating in the meeting. Now we're going into a break. So we will, we will reconvene at 11:15 with session 1, developing diagnostics and therapeutics. And it will be a very interesting session with 3 of the main experts on this area, Dr. Lundgren, Sergio Carmona, and Nathalie Stroop-Bugart. So don't miss the next session, please. Thanks a lot.
Thank you. Very nice to meet you all. Bye.
Bye-bye.